to you about different types of laser surgery that's available. There's a few things that we need to know first in order for us to be able to tell you whether you are a suitable candidate. The first thing is we need to make sure that your prescription is stable. That means for a few years in a row your script shouldn't change, because we can actually only laser what we are measuring on the day. If you are going to regress or progress to a different script because of that's just how it is, we can't predict where you're going to end. So we want to know that the script is stable. The second thing that we need to know is what your cornea looks like. Is it thick enough to have, do we have enough cornea to work with? And is the shape of the cornea regular? We can't do laser on a shape of a cornea that is not completely regular. I'll touch up on that a bit later again. The third thing that you need to know is that laser is possible for far-sighted people, short-sighted people, as well as astigmatism. You refer to that as myopia, hyperopia, and astigmatism. There's two types of laser that we are currently doing, and the one is called Lasik and the other one is called PRK. The Lasik procedure is the more popular procedure because we regain your vision to an appropriate level the day after surgery. How the Lasik actually works is, if you think of a book, and this is your cornea, the window of the eye, we create like a first page of the book we open so that we can apply the laser on the second page. What's nice about that is we put that first page back and you have almost no discomfort, a little bit of dryness, and that's why your vision following day is already where we basically want it to be. In order for us to be able to do Lasik, you need in relation to your prescription enough cornea for us to create that first page and be able to apply the laser onto the second page. In cases where your prescription is maybe higher and your cornea is a bit thinner, and we calculate that there's not going to be enough laser for us to create what we call a flap, then we'll consider doing the second type of laser procedure, which is called PRK. Now in PRK, we apply the laser directly onto your cornea. What we first do is we take the first layer of your cornea, the cells we take off, and then the laser gets applied directly onto the cornea. What we then do is to put a bandage contact lens on. Now when we say bandage, it's just a clear contact lens, because we want you to have a contact lens on, so when you blink, it's going to be not too uncomfortable. What will happen is the difference between PRK and Lasik, the eventual outcome is exactly the same, but with PRK you are only 3 weeks down the line where you are already on the first day after Lasik, so it takes longer for you to get to the appropriate level of vision that we want you to have. The thing with PRK is also that you have a slightly bit more discomfort because we've removed the first layer of your cornea. What we need your cornea to do there is to regain to regenerate those cells that we have removed. Usually how it works with PRK, the following day you come for your follow-up appointment, we have a look to see how the cells are regrowing, and then only on the fourth or fifth day after the surgery we'll remove the contact lens. In order to prevent some of the scratchiness that you'll experience afterwards, we will give you a lubricant to use, so you can use that as much as you want to in order for you to have more comfort after the procedure.